medial rotation is also called inward rotation, and that's just turning a body part towards the midline. Whereas the opposite of that is called lateral rotation, which rotates the body part away from the midline or also just out laterally. Protraction is when your scapula, which is also just the anatomically correct name for your shoulder blade, is going to move away from your vertebral column, which is your spine. So when you reach out in front of yourself, you extend your arm out, you're going to actually cause protraction of your scapula. If you feel your shoulder blade as you reach out in front of you, you'll feel your scapula moving away from your spine and kind of sliding along your ribs there. And that's what protraction is. The opposite of protraction is going to be called retraction. And this is where the scapula is going to move closer to the vertebral column. So when you pinch your shoulder blades together, you are retracting both of your scapulas. Elevation is just going to be lifting the scapula up superiorly. So if you actually do a shrug where you bring your shoulders up closer to your ears, you are elevating your scapula. And the opposite of that is just called depression, which pulls the scapula down. Plantar flexion is going to be pushing your foot and toes downward. So when you stand on your tiptoes, that is actually plantar flexion. And the opposite of that is dorsiflexion, which is raising your toes up to the ceiling and your foot also. Pronation is going to be rotating the forearm and your hand. So if we're going from anatomical position, if you'll recall, our palms are facing to the front. They're facing anteriorly. So when you just rotate only your forearm to where your hand goes and faces posteriorly, that is called pronation. And the opposite of that is called supination, which is going to rotate the forearm back to anatomical position where it faces forward. Inversion is going to be tilting the sole of the foot towards the midline, so almost like an extreme case of pigeon-toed. That is what inversion is. The opposite is eversion, which will tilt the sole of the foot away from the midline, like trying to raise the outside of your foot to the ceiling. Now that we have the basic muscle actions down, we're going to learn about muscle classification. So sometimes it's helpful for us to put muscles into classes depending on what they look like or their shape. So our first one's called a longitudinal. Now these are the weakest, but they're able to move a greater distance than the rest of them. There are two subdivisions to longitudinal. The first one's called parallel. This is where the fibers just run parallel to each other along the muscle itself. The other subdivision is called fusiform. And so with the fusiform muscle, that is where the muscle belly in the center is fatter than the tendons on two ends. So kind of like our little classic muscle example here, where we had a tendon on each side and a big fat muscle belly. That would be just a classic fusiform muscle. Our second class is called radiate, or also called convergent. This is where the fibers are going to originate in lots of different places, but they're going to come together on a single tendon. It's going to make it kind of look like a fan. The importance of this muscle classification is that if only some parts of the muscle contract, it will perform a certain action. And then if muscles or the fibers on the other side contract, they will be able to perform a different action. So they're able to perform lots of different actions.